So I often hear patients say that they've done the cognitive behavioral therapy strategies before, they've done CBTI and it didn't work for them. And when I ask them what they've done, typically they say something along the lines of, I don't drink alcohol at night, I make sure that the room is really dark and cold, I wear my eye mask, and I make sure, it's nice and quiet in there. And although these are all very helpful strategies in general for sleep health, that's not exactly all that CBTI is about. And really that component, that sleep hygiene component, is not the sort of more effective components when it comes to treatment of chronic insomnia. So in this video, I'm actually going to talk more in depth about what is sleep hygiene and how is it different from CBT for insomnia as a more effective intervention for chronic insomnia. If you don't know me, hi, my name is Dr. Parky. I'm a clinical psychologist and behavioral sleep medicine specialist. I'm also the author of the self-help book. Let me grab that. Right here, which is a book that talks about the insomnia strategies and CBTI strategies that are helpful to treat chronic insomnia specific to your sleep problem. So from a definitional perspective, sleep hygiene really is all about optimizing our behaviors as well as the environment to make sure that the bedroom is as conducive for sleep as possible. So some components of sleep hygiene include things like making sure that the room is dark and nice and cold, and making sure that it's a nice environment before going to bed. In terms of your own behaviors, it's things related to not drinking alcohol before bed, because alcohol has a metabolic effect, especially in the middle of the night. It helps people fall asleep quickly, but it creates more awakenings in the middle of the night. Or not taking caffeine, obviously, as a stimulant, before bed especially, like it's going to make it hard for you to fall asleep. So all those behaviors, again, they make very good sense from healthy sleep. Like you don't want to be drinking 3 glasses of wine just before bed, or taking a caffeine pill. Like all those things are going to make it very hard for you to be able to fall asleep and stay asleep, but they're not actually the strategies needed to get you out of the insomnia trap. And research has suggested that sleep hygiene in and of itself is not a standalone intervention for insomnia disorder, and the American Academy of Sleep Medicine doesn't recommend it as a standalone single intervention for treatment of chronic insomnia. And sleep hygiene, interestingly though, is a part of cognitive behavioral therapy for insomnia. And as you might imagine, for CBTI, cognitive behavioral therapy, it's actually a multimodal treatment. And what I mean by that is that CBTI has many different components. It has a cognitive component, it has a behavioral component, it has a bunch of different components to make sure that we have a sort of really wholesome treatment, a fulsome treatment, not wholesome as well. It's a, it doesn't require medication, it doesn't have as many side effects. So it's wholesome in that way, but it's fulsome in so far that it allows to treat many different causes of insomnia. So sleep hygiene is only one part of a larger, broader set of interventions as part of CBTI. So unlike sleep hygiene, CBTI is actually an effective and durable treatment of chronic insomnia. Many people stand to benefit even after having decades of insomnia, behind their backs, that they can be treated relatively effectively within 4 to 6 sessions for many people, seeing, big benefit. And importantly, the treatment CBTI also is very durable. So even after 10 years following treatment, decades after treatment, people still notice the benefits after stopping and finishing up the treatment after finishing CBTI. So it's a very effective, durable treatment as compared to just sleep hygiene, which is great for sleep health, but not sufficient in and of itself to treat insomnia. So just to briefly talk about some of the other components of CBTI, one of them being sleep hygiene, the other components include things like sleep restriction therapy, where we are bringing how much time we're spending in bed a little bit closer to how much that we are sleeping. So oftentimes people with insomnia will engage in what we call compensatory behaviors, which are behaviors that make good sense because they just had a poor night, but actually perpetuate insomnia in the long run. Like if they're sleeping right now 7 hours, but they're spending 10, 11, 12 hours of time in bed because they're having such a hard time falling asleep, for example, then over time, that's actually going to reduce how much pressure that we're building for sleep the next night, which is going to keep us in this sort of weird insomnia trap. So sleep restriction therapies are meant to bring that sort of time in bed a little bit closer to how much sleep you're producing right now. Usually it's total sleep time plus about 30 minutes. So if you're sleeping about 6 hours, then your initial time in bed recommendation would be about 6.5 hours. So that's one way to just squeeze out some of those awakenings, improve the sleep quality before focusing on the quantity after the initial restriction. And another really effective strategy is known as stimulus control. So stimulus control really is meant to break the association between bed and wake. So as you can imagine, someone who has insomnia, who's constantly in bed, ruminating, feeling frustrated, tossing and turning, the bed in the bedroom has become sort of like negatively associated with sleep. Like it's not a conducive place to sleep anymore. And you might have that experience where, you're able to maybe fall asleep on the couch, or you don't feel so worried about sleep. But as the night encroaches, as you're in the bed, it's like your mind just starts racing. then that's a good sign that your bed has become associated with this sort of wakeful pattern, and stimulus control is meant to break that association. So some of the recommendations include making sure that you're not going to bed until you're actually feeling sleepy, making sure that you get out of bed when sleep is not coming and you're doing something enjoyable, as well as making sure that the bed is mostly for sleep. So you're not working in bed, you're not tossing and turning, worrying in bed, you're just using the bed primarily for sleep. And alongside sleep restriction therapy and stimulus control, there are also other behavioral strategies primarily meant to reduce arousal. So people with insomnia are often in this fight or flight response where they're constantly in the state of like hyperarousal. So there's a number of different strategies that CBTI employs. For example, relaxation strategies like deep breathing, progressive muscle relaxation. It can also be like an intentional wind down. So an hour before bed, you're doing something that you enjoy and is relaxing for you, as well as other different strategies just to help to kind of like bring things down, get you closer to like a calmer level so that sleep is more readily able to take you away at night. So alongside some of these behavioral strategies, both for the nighttime and also for the daytime, so there are some strategies like activity pacing or scheduling activities to really make sure that we're getting as much energy as possible during this period of working on your sleep. There's also some cognitive strategies. So cognitive behavioral strategies, meaning that a big part of it is focusing on the unhelpful thoughts that maintain sleep problems. Like, if I don't fall asleep tonight, tomorrow's going to be horrible, or, it's just a frustrating experience when I'm in the middle of the night and I'm so scared. Like all of those kind of like scary thoughts and anxious beliefs make it hard for us to break out of the insomnia trap. So one thing that cognitive behavioral therapists do is to target some of these unhelpful thoughts and navigate these thinking patterns to get you out of this sort of anxious trap and make sure that when you do go to bed, these kind of unhelpful thoughts aren't a barrier for you to be able to sleep well. So hopefully this video was helpful for you to learn a little bit more about sleep hygiene and that it is a fantastic part of sleep health, but not sufficient in and of itself for treatment of chronic insomnia and the actual gold standard for chronic insomnia, which is cognitive behavioral therapy for insomnia. I know I didn't do a complete deep dive into all of these strategies, but on this channel there are a lot of videos that do talk about these strategies in more detail and how you can apply it into your life. And if you do want to get my book, it talks about these strategies in even more detail and will help you to become your own insomnia therapist to deal with your sleep problems. The link is in the description below. But otherwise, again, hope you had a good time learning about sleep and insomnia, and I'll see you in the next one. Bye bye.